This exercise is called the standing hip raise. It's excellent for balance if you struggle with sciatica issues, if you're looking to address issues in the pelvis, the hips, and the low back. And it's also a really great modification for the side curl. So we start by just standing in a comfortable position, but we want to bring our feet so that they're straight forward and they're about a fist width distance apart. If that is too challenging for you, you can bring your feet a little further apart, but the goal is to have them about a fist width distance apart. And for this exercise, we're just going to be raising or shifting one hip up towards our armpit at a time. So what's going to happen is the leg will stay straight, but the heel will lift off the floor just a tiny little bit as you shift. And then we'll release back down as slowly as we can. So getting into position and closing the eyes. Start with whatever side you tend to experience less pain or tension in. And we're just going to shift that hip up towards the armpit, just enough so the heel comes off the floor, just about a centimeter or an inch. And then notice here where your weight is. Notice your balance and all the muscles that engage. And then to a count of 6, we'll release that hip so that the heel comes back to the floor. 1, 2, 3, 4, 5, 6. And just relax. You always want to pause before moving to the opposite side. And then the opposite side, shifting that hip up towards the armpit so the heel comes off the floor just a bit. Notice if this feels different on this side. Notice your balance and the muscles that engage. And then we'll release that side to 6. 1, 2, 3, 4, 5, 6. And just relax. Make sure you're not holding your breath during this exercise. So we'll move back to the other side, shifting that hip up. You could make it even smaller this time. Keep the leg straight. Notice your balance. Notice all the muscles that engage in this exercise. And then release that hip, allowing it to slowly lower, heel coming back down to the floor. And just relax. I like to take a nice relaxing breath here in center. We'll move to the opposite side. Again, we're noticing how it feels, if it feels different than the first time, and then the other side. And then releasing that hip as slowly as you can, allowing the heel to slowly come back down to rest on the floor. And take a nice relaxing breath. And you can go back and forth in that exercise as many times as you want, just really tuned in to how it feels on both sides. Also noticing what muscles engage. You might notice the opposite side of the body engaging to help you stay balanced. You're recruiting those muscles to help you do this movement. But the muscles that are actually contracting and releasing or pandiculating in this movement are the muscles of your obliques. So when you shift that hip up, these muscles contract and then release as you lower back down. So we're working with the core of the body. We're working with our center of gravity, our center of balance to release any unnecessary tension in these muscles.